Hi, everyone. My name is Debbie Bryson, and I serve on the board of the Capillary Parkinsons Society. I have been very blessed and honored to be able to serve with CAPS for the last 15 years. So you guys have become a little second family for me, which I love dearly. I'm going to make a couple announcements today that we have before I introduce our speaker. The first big announcement, as you guys know, is Parkinson's Awareness Month is in April. So please go on to our website, capitalairparkinsons.org, and look at all the upcoming events that are happening in our community for Parkinson's awareness in the month of April. One of the big things is we have a new partnership with Freytag's Community Blooms. And now, anytime you make a purchase online through Freytag's with the CAPS code that you'll find on their website, any order you place, they're going to give a 5% give back to CAPS. So we're very excited about that. Some of you may already know that we have a similar partnership with Amazon Smile. So anytime you order anything through Amazon Smile, they give a give back to CAPS. And as you guys know, as a nonprofit organization in 2020 and then still in 2021, it's been really difficult. So any way that you guys can support, we really, really need it. So think of those two things anytime you go to order online, Amazon Smiles and Freytag's Community Blooms. All right, I'm going to go ahead. Oh, one other quick thing. On our website, we have a new members only section. And it's a little tab you'll see, and you click on members only, and it gives you a lot of information about the benefits of being a member of CAPS. Membership is only $25 a month for an individual, or $40 a month, $25 a year for an individual, and $40 a year for a family. And one of the wonderful benefits that you receive is our CAPS Cares program, which is a free program offering social work, respite care, community resources. There's a really long list of everything that CAPS Cares program could do for you, your loved one, or your family. So please go online and look at that, because it's a really, really great program. And we want you to utilize it anytime you need. So, all right, I'm going to go ahead and introduce our speaker for today, Dr. Wijemanne. We have been blessed to have her as a speaker last year, and she was absolutely wonderful, and she agreed to come back and educate us again today. So we're very excited to have her, and she's just an awesome speaker and an awesome physician. So to tell you a little bit about her, she completed her training at Tufts University in Boston, Massachusetts, where she also served as chief resident. She furthered her training at Baylor College of Medicine in Houston, Texas, with the Movement Disorder Fellowship. At her practice, Dr. Wijemanne takes a holistic approach to management of various movement disorders, including Parkinson's disease, tremors, restless leg syndrome, dystonia, tardive dyskinesias, Huntington's disease, ataxia, Tourette syndrome, tic disorders, progressive supranuclear palsy, multicentric atrophy, corticobasal degeneration, spasticity management. She's awesome. Dr. Wijemanne is also trained in special procedures such as botulinum toxin injections and deep brain stimulation procedures, and offers advanced management of advanced Parkinson's disease. So, in addition to her clinical practice, Dr. Wijemanne is the author of multiple publications in her peer-reviewed journal and is a teacher to both students and residents. She also has research experience in clinical trials for movement disorders. So we love her a lot. Dr. Wijemanne, thank you so much for being here today, and I'm going to turn it over to you. Bye, guys.
Hi, everyone. A warm welcome to all of you joining in today. I'm Dr. Subhashie Wijemanne. I'm a neurologist and a movement disorder specialist. First of all, I would like to thank the Capital Area Parkinsons Society for the kind invitation. Recently, I opened my own practice here in Austin, and I'll share some of that information towards the end of the presentation. So today, I'll be speaking about sleep, the importance of sleep, and how sleep is affected in Parkinson's disease. As you know, sleep has a very important physiologic function. Um, we often talk about the benefits of exercise, and diet, but often tend to the neglect of sleep essentially, or pay less attention to that. But I'm here to emphasize that sleep, again, like diet and exercise, is part of our overall well-being. So there are changes that take place as we age. So this quality of sleep may be affected purely because of our age, but it's not only that; it is also affected in by Parkinson's disease. So there are various reasons why sleep is affected in Parkinson's, and I'll be going into some of them in more detail. So talking, okay, so this is the outline of my talk. I'm going to start off with a brief introduction to sleep. Sorry. And go over what the normal sleep patterns are, and then what are these changes that take place with age, and then move on to more specific how sleep is affected in Parkinson's disease by itself, and then go over the different causes and causes of insomnia, and then talk about management and the steps that we can take to improve it. Okay, so let's start with the question of why is this sleep important? Um, so, as I mentioned earlier, sleep has a very important physiologic function. So, it goes without saying, or it emphasizes the importance of a uninterrupted sleep on a regular basis. We are all aware of how, if you had a bad night or had poor sleep the night before, how that is affecting us: poor concentration, lack of energy, and so forth. But sleep overall, recent studies have shown that sleep has a far more important function than we knew before, because sleep itself has a important housekeeping function in the brain. It is said, as the studies show, that it is during sleep it removes the toxins from our brain. Or maybe these could be just the byproducts of things that happen to while we are awake, and the cleaning is done while we are asleep. So if one is to neglect their sleep over long periods of time, so we're talking about chronic insomnia, this can have a big impact on our cognitive function long term. So something to keep in mind. So this is another reason to kind of put that emphasis on getting a good night sleep. Okay. So moving on to the next slide, I'm going to just go over very briefly about the normal sleep wake cycle. Um, so this is characterized by two alternating phases. One is called the rapid eye movement sleep, or we call it in brief, in short, REM sleep, and then the non-rapid eye movement sleep, which is the non-REM sleep. Now, each stage is defined by different things. So there are three things that basically define which stage of sleep you are in. One is the brainwave activity. So if somebody is to have a sleep study and have electrodes attached to the brain, attached to the skull, that can record the different electrical activity during different stages, and that helps to tell us which stage of sleep one is at. And also muscle activity, particularly in a REM sleep. When we are in REM sleep, the body muscles are not active, or we can use the word paralyzed. Whereas in the non-REM sleep, the muscles can be moved. So these muscle activities, the status of the muscle activity also tells us which stage of sleep we are in. Then the eye movements is the next. So these are the three components that may tell us what stage of sleep we are in. So again, coming back to that slide of this normal sleep-wake cycle, if a sleep cycle is 8 hours, we go through alternating phases of non-REM to REM to non-REM. So looking here, you could see that we start with a non-REM sleep and it goes into different stages, and the stages deeper sleep as we sleep. So from stage 1 to stage 4, which will be the deeper sleep, and then we kind of wake up, come lighter in our sleep, and then go into our first REM sleep, which is indicated by this um, red, marked in red. So, through an 8 hour sleep cycle, we may go through about 4 to 5 stages of REM sleep, and this is a very important for our overall quality of sleep. On the side here shows the different how the brain waves change during different stages of sleep. Um, so REM sleep have a very characteristic feature, whereas stage 4 compared to stage 4 and so forth, and helps us to identify the stage of sleep. Now, talking about circadian rhythms, probably the sleep-wake cycle is the most obvious of our body clocks or body circadian rhythm. We're awake during when the sun is bright, and we are sleeping when the sun is down. This is based on the light. So in addition to the light, the amount of light, it is also affected by several other causes. One is aging. So aging itself definitely affect the quality of our circadian rhythm, how strong our circadian rhythm is. Then if one is to travel through time zones, time shifts definitely affect our. We are quite aware when uh, time changes. Uh, Time daylight saving time itself by just 1 hour, how that affects our sleep. But if you were to travel um, across time zones, then you definitely feel the change in your body. Exercise is another one. If one is to exercise late in the evening, that can definitely affect your circadian rhythm. And of course, as I mentioned earlier, the most important one is the light dark cycle. So when there's bright sunlight, we are awake. When there's no sunlight, that's when the circadian rhythm goes into the sleep cycle. So dark light dark cycle is the strongest external influencer of the circadian rhythm. So let's moving on to the next slide, asking the question, so what are the changes that take place in our sleep patterns as we age? So one of the things that happen is we may start waking up earlier in the day, earlier, earlier in the day, and go to bed earlier than we used to when we were young. And also a more interrupted sleep. So we tend to wake up more often than we did when we were much younger. And then also have more difficulty in falling back asleep after waking up when compared to a younger person who may immediately fall asleep, but as we age, that may be affected. So there's this difficulty in falling back asleep. And also, another feature of aging itself is that there's more sleeping during daytime, more napping during daytime, and also a reduced amount of deep sleep. Now, deep sleep is entry, or we call deep slow wave sleep, is very important to achieve that good quality of sleep. And this may be reduced as well, which again, age itself interferes with our quality of sleep. So this is just so okay. So then, what is considered a good night's sleep? So obviously, uninterrupted sleep. And when you're talking about how many hours of sleep one needs, these are just average. Nothing is set in real, stone. Um, it varies from person to person. These are just average numbers. So for older adults, adults over the age of 65 is 7 to 8 hours of sleep, and adults over 20, between 26 and 64 years of age, a little bit longer, 7 to 9 hours of sleep. So it's quite a lot of sleep. So a minimum of 7 hours, that's what it is. So we had to ask our question, do we get that 7 hours of minimum of 7 hours of sleep? So there are ways to track sleep. As you know, nowadays there are devices that can help you to do that. It tells you how many hours you were in REM sleep, non-REM sleep, and how many times you were interrupted during sleep. So these wearable devices can be very useful to kind of track your sleep. So the question is the sleep affected in Parkinson's disease? Of course, the answer is yes. So people with Parkinson's disease have more sleep disruptions than similarly compared age people without a Parkinson's disease. So when you talk about the type of involvement, usually patients with Parkinson's disease don't have trouble falling asleep. So they don't have trouble initiating sleep. It's not a major challenge, but most often it's a case of inability to maintain sleep. So interrupted sleep through the night. So it's a sleep. We call it a sleep maintenance insomnia. So that's the most one what we see more frequently, but it can always be a combination of both. So these are some of the common causes of poor sleep in Parkinson's disease. Insomnia by itself, by definition. I'll go over that in a little bit more detail. Then the other features that are unique to patients with Parkinson's disease, this could be tremors, stiffness, slowness of movement, and painful dystonic spasms. So tremors, of course, tremors usually disappear when one is asleep, but that can prevent one from falling asleep, especially if somebody has a tremor dominant form of Parkinson's. The tremor can really prevent a person from falling asleep. Then stiffness. Stiffness can cause pain. Stiffness can make a person difficult to turn in bed. So all these things can make the person uncomfortable and then, of course, interrupts their sleep. Moving on to the next item is the REM sleep behavior disorder. This is a very interesting phenomenon that we see in Parkinson's disease. It's not unique to patients with Parkinson's disease, but it is seen very fairly frequently in patients with Parkinson's disease. And I will go into detail in a separate slide. Another reason that patients with Parkinson's have trouble sleeping is restless leg. Restless leg by itself is a very common disorder in general population at large that interrupts the sleep at night. Often it's a sleep initiation and also sleep maintenance as well. But there's increased risk of restless legs in patients with Parkinson's disease. So that's something to keep in mind. In fact, about 20% of patients with Parkinson's disease may have restless leg, and that could be the main reason why somebody is not falling asleep or a big contributing factor to overall sleep quality. Moving on, next is nocturia. So nocturia can be a complication of Parkinson's. It can affect Parkinson's itself, affect the bladder function. One of the common presentation is an overactive bladder, and this can keep a person awake at night. And so that can be a major sleep interrupter. So if that's the case, addressing the bladder issue with medications or other measures can really help to improve the quality of sleep. Moving on to the next potential cause of poor quality of sleep in Parkinson's is depression or anxiety. So people with depression, regardless whether there's Parkinson's or not, have trouble getting a good night rest, especially they are woken up early in the early hours of the morning and will have trouble falling asleep. So that can be a reason. So need to explore that when we are kind of exploring why somebody's not sleeping. Then the Parkinson's medications itself, the dopaminergic medications can interfere with the sleep, and that needs to be looked into. Another aspect of talking about sleep in general in patients with Parkinson's disease is they can have a lot of daytime drowsiness. Now, this can be directly related to the medications like the dopaminergic medications, or even outside of that, there is an element of drowsiness that is associated with Parkinson's disease. So this is important because moving on to the next slide. So insomnia, this can affect as many as 60 to 76% of patients with Parkinson's. So as I said, when you talk about insomnia, we have to inquire a little bit in more detail. Is the problem falling asleep? This is called sleep initiation, as I mentioned earlier. Or is it sleep maintenance? Or is it a combination of both, which is often quite frequent? Or is it just early morning awakenings is the issue? So the biggest problem in Parkinson's, as I mentioned earlier, is the sleep maintenance issue. So sleep fragmentation. This is by far the most common type of insomnia and most common complaint in patients with Parkinson's disease. So this can be due to the advanced disease as the Parkinson's progress and more advanced the condition is. You can have more interrupted, more fragmented sleep. And also studies show that female may be affected more than male. Okay, so when somebody with Parkinson's disease, when as specialists, when we recognize that somebody is not sleeping well, so we need to go into it in more detail to find out exactly what are the reasons for that? What are the causes of interrupted sleep or poor sleep in that particular person? So one of the things we inquire about is, are the person having vivid dreams and nightmares? Now, this can be due to medications, particularly to the dopaminergic medication. So if that's the case, sometimes it's a case of kind of shifting the dose to earlier in the afternoon or evening, and that may help to avoid some of the vivid dreams and nightmares. Moving on to the next is the REM sleep behavior disorder. Now, as I said earlier, it's very common in patients with Parkinson's disease, and it may happen or start years before somebody develops motor symptoms for Parkinson's. So this is where a person either talks in their sleep or act out their dreams in their sleep. Now, in normal sleep pattern, we dream during REM sleep. And when during REM sleep, our muscles are inactive. That means the muscles are essentially paralyzed. They cannot move. So that's what typically happens in normal REM sleep. But people or patients who have REM sleep behavior disorder, these muscles are not paralyzed during sleep. So if a dream calls for an action scene, like maybe it's a chasing scene or a fight scene, then you see the person kind of flailing their arms and kind of acting out the dream. So that's what is called the REM sleep behavior disorder, or in short, we call it RBD. So if somebody is having very frequent episodes of this, it can really affect or interrupt their sleep. So it affects the quality of sleep. Not only that, it can become a question of safety. I've had patients who fall off the bed and fracture limbs, or hit the wall and injure themselves or injure the bed partners, the spouse. So, if these are happening, then we need to address this. So there are medications that can help to control REM sleep behavior disorder. Melatonin is one, clonazepam is one. So these medications can really help. They don't eliminate the issue, but definitely help to control it. So generally, we don't do a routine sleep study to diagnose this. The history itself may provide strong evidence of that, but definitely a sleep study can help to confirm it. So that is definitely an option. Moving on to another important cause of insomnia in patients with Parkinson's disease is restless leg. So as I said earlier, it's a very common movement disorder in general population, but 20% of patients with Parkinson's disease can have restless legs. And now, why there's an increased risk of restless legs in Parkinson's disease, we don't know. There's no evidence to say that those who have restless leg progress to go on to develop Parkinson's in the future. No, there is no association like that. But those who have Parkinson's disease have a higher risk of restless leg. So it's another area that as specialists we inquire, like when we take a detailed history of for sleep history. This is one of the areas that I pay a lot of attention. I have a special interest in restless legs, so I often come across quite a lot of patients with this condition. And for one, we can treat it, help to control it, so overall can improve the quality of sleep. So the typical symptoms of restless legs are it's again what is a circadian disorder. So it's a disorder that typically happens in the late evening or night when somebody tries to rest, sit down and rest, or lay down in bed and go to sleep. So it is when somebody tries to rest, that's when the symptoms come. So one may experience various sensations in the legs that could, different people use different adjectives to describe these sensations. It could be a sense of tingling, crawling, cramping in the legs. Not only the sensory symptoms, but they also have this strong urge to move the legs. They just simply cannot keep their legs still. They have to move them around. So they could be just massaging or just moving the legs in the bed, or sometimes it is so bad they have to really get out of bed and walk around to really relieve the symptoms. So by doing that, it provides a temporary relief, so they come back to bed, and if they're lucky, they'll fall asleep again. But if the restless leg, for some people, come on very quickly, and it may just come on so quickly that it's just that continues throughout the rest of the night, interrupting, not allowing them to fall asleep. So there are good, effective medications to help to control it. There are no cures, but it can be effective. So something to definitely see. It's important to see whether this is the reason for the poor sleep at night. Okay, so one of the other things, features or things that we see in patients with Parkinson's is the excessive daytime sleepiness. Patients are very drowsy during daytime. Now, it could be that, I mean, obviously, somebody is drowsy during daytime because they're not getting enough sleep at night. So that has to be explored and see what are the reasons. And if so, you address that. And so improving nighttime sleep can reduce the number of how drowsy they are during daytime. So the quality of night sleep is important. Uh, then not only that, by inversely, if somebody is drowsy during daytime and taking too many naps, that can definitely affect the circadian rhythm or the body clock. So that's the other side of of the coin, so to speak, that it is not good to take too many naps during daytime, because it's going to affect the quality of sleep at night, because now the body clock is confused. When should the sleep happen? So that further undermines the strength of the circadian rhythm. So this is another area that we pay attention to when we take a detailed history of sleep, to make sure that somebody is not taking too many naps. Now, yes, on the other hand, Parkinson's disease, there are various other reasons why a person is drowsy. Medications is a big one. Dopaminergic medications can often cause drowsiness, and I have, patients, after their each dose, they take a 20-minute, 45-minute nap. So definitely that can be the reason for the excessive drowsiness. Um, yeah, okay. Um, okay, moving on to the next topic about overall, how do we manage? So when you talk about management, again, going back, it's so important to, as specialists, we take a detailed history of quality of sleep in all patients with Parkinson's and try to address, see whether somebody is getting adequate sleep or not. So the history, the information give us a lot of clues as to what may be going on. So taking a detailed history of the sleep and quality of sleep is the basis, is the it has to be done, is the important part of in the management. So once we recognize the different areas that is affected, then we can talk about management. So one of the ways we can really track the quality of sleep is to do a sleep diary. Now, if you look online, there are various forms that you can, select for this, and chart the sleep. And this can be very interesting, and we'll probably recognize things that we didn't realize was affecting our sleep. So a sleep diary might be a starting point. Kind of tracking how much sleep. And again, earlier, as I mentioned earlier, using devices, the sleep tracking devices is the latest, way to track the sleep at home without needing a formal sleep study. I mean, that could be the start of really, getting more information before you had to get before you go ahead with a formal sleep study at a sleep center. So talking about, measures to improve sleep, you will hear about the importance of sleep hygiene. So that's a term you use to emphasize these important concept. So it is important that we have a regular uh, wake up time and a bedtime. So that tells our body, the body clock, this is what's happening, and it will stick to that time. So if we have very big changes in our wake up time and bedtime, that can definitely affect the quality of our sleep. So another thing that we emphasize is to have a bedtime routine. One cannot go from a very intense exercise program straight into sleep. Uh, we have to tell the brain or prepare the brain to fall asleep. So that's the importance of a bedtime routine. So that tells the brain, okay, I'm winding down, and then I'm preparing myself to sleep, so that the activity level gradually diminish, is tapered, and then allows for the natural sleep to take place. So having a bedtime routine, it is different for everyone, but that is a signal telling the brain, okay, I'm getting ready to fall asleep. And then reserving the bed only for sleeping. Sometimes we are guilty. If we have a television in our bedroom, we could be just watching television. And so that can, I mean, definitely watching to the fluorescent light, the light coming from the LCD screen, these can definitely affect your quality of your sleep. So that by itself, but also reserving the bedroom just for sleeping also is like a part of the bedtime routine that informs the brain, okay, I'm now heading to sleep, so that it'll prepare you for a restful sleep. And also, of course, it is obvious we need to avoid any kind of stimulant, alcohol, caffeine, nicotine. All these things can keep you awake at night. So avoiding these several hours before your bedtime routine is recommended. And then also reducing the time of naps you take during daytime. Now, as I said, the normal aging process itself may predispose to one having more daytime, feeling drowsy and needing naps, but the recommendation is to have a scheduled nap time. So, and to make it less than 1 hour. So, not to take multiple naps, but to schedule perhaps one nap every day at a specific time. That may help. And it may help not to confuse with the circadian rhythm and the night sleep. So having a scheduled sleep as opposed to falling asleep throughout the day. And another important to strengthen to the circadian clock or the circadian rhythm is to be exposed to sunlight. So I often advise patients to get good sunlight in the morning, and that can really help with the body clock. As I mentioned earlier, emphasized earlier, that the exposure to light is a strong external factor in strengthening your circadian rhythm. So if one is constantly indoors, not exposed to sunlight, that can really confuse the body clock. So being out there, being exposed to sunlight really helps to reset the clock or strengthen your circadian rhythm. And that can help with getting more quality sleep at night. Um, so talking about management, okay, I've talked briefly about the sleep hygiene program. So that is the first step, kind of understanding it's a process. And that we have steps that we have to follow to make sure that we achieve our goal. When somebody is very young, perhaps the sleep hygiene routine may not be important. The body clock is so strong, the circadian rhythms are so strong, it'll put a person to sleep very quickly. But as we age, we need to adopt these measures to make sure that our sleep is strong and is uninterrupted. So these measures or steps can be vary from person to person, and not everyone will fit majority. So you have to kind of select what works best for you. And talking with your physician, you can perhaps gather more information that may help just to cater for your unique situation. So one of the like kind of a broader advice would be don't spend more than 15 minutes trying to fall asleep. 15 minutes later, if you're not asleep, it's better to get up and do something different until you're ready to fall asleep. So what is recommended is low light and sedent have low lights. Maybe you can read. Uh, we listen to some light music or meditation. Now, reading can be very tricky because that can activate your brain. So, generally avoid reading at night or watching television. Again, that bright screen light can really interfere with the light and the circadian rhythm, and even make your insomnia much worse. Because as it turns, is if you're not sleeping, you go and watch television, not may not be the best choice. So think about so avoid these like reading in bright light or watching television uh, if you have trouble sleeping, and return to bed only when you're feeling sleepy. Other measures like common sense, earplugs for noise, keeping the light very dim. It goes without saying. These are kind of common sense steps that we can take. So again, earlier I mentioned about alcohol. You should not drink 4 to 6 hours before bedtime, and also avoid heavy exercise 6 hours before bedtime. Definitely can interfere with your night's sleep. A night snack can help, and so forth. And also says that to avoid looking at the clock, that can generate more anxiety and prevent somebody from falling asleep. So that's one advice. You'll see that it's not just for Parkinson's, it's a common advice that is for anyone who has sleep issues to avoid looking at the clock. Okay, so sleep hygiene or steps that you take are very important. And sleep medication is only a supplement to that. It's not recommended that everyone should be on a sleep medication. Because if there are steps that we can take to help, then we probably don't need a sleep medication. I'm not going to spend a lot of time here going into detail, but there are different types of medication depending on what type of sleep issue it is. Is it a sleep initiation issue, or is it a sleep maintenance issue, or if it is a combination, then we can decide on which medicine works the best. Melatonin is probably is over the counter, and it is the natural hormone for sleep. So probably my first recommendation as a medication to help with sleep. And then there are various other medications which you can talk to your physician about. If you feel like the high sleep hygienes did not help with your sleep, then maybe that's the time to talk about sleep medication. But that again, once you start sleep medication, again, you have to maintain or continue your sleep hygiene measures. It's always a combination of both. So one of the issues with sleep pills is it can cause agitation. Sometimes certain sleep medications can cause amnesia, some kind of unusual behaviors, and so forth. And it can cause morning drowsiness, and that can lead to falls and and so forth, and lack of focus and confusion. So, and also can interact with alcohol. So, before you start a sleep medication, these are some of the things to kind of be aware. But if some sleep medication is required, then you have to take a sleep medication to get good night's sleep, because the lack of sleep, poor quality sleep, interrupted sleep is overall is not good. Because particularly in Parkinson's, we know if somebody had a poor night's sleep, the following day their motor function is affected. There may be issues with balance, and more tremor and so forth. And a majority of patients with Parkinson's know that they'll have a good day if they had a good night the night before. So it's another way of, I'm emphasizing the importance of sleep in overall motor function with somebody with Parkinson's. Okay, we are coming towards the end of the presentation. So again, to address the excessive daytime sleepiness, again, is another area that I kind of spend time taking. A detailed history can help here. So emphasizing on the quality of night sleep and looking at the patient's medications. Is there anything that is interfering with the night sleep? And medications that may interfere, make a person drowsy during daytime, and then go into the causes of various causes. And if needed, we'll adjust the Parkinson's medicine to improve health, improve sleep. And then talk about a scheduled nap time, maybe definitely before 3 p.m. can help if somebody's like feeling very sleepy during daytime. So one can use caffeine is appropriate. And if still somebody's having excessive drowsiness, and especially if somebody's has a challenge in taking dopaminergic medications, especially, I mean, that's a very important part of how we manage motor symptoms. So if that is causing a lot of drowsiness, or overall, regardless of the medicine, there's quite a lot of excessive daytime drowsiness, there are medications that can help to keep oneself awake. And the two examples are modafinil and methylphenidate. That concludes my talk, and just this is a screenshot of my website. As I mentioned earlier, I opened my practice here in Austin. So if you want more information, the website is here. And I'll leave it there. Thank you very much, and thank you for your attention.